your question, but it's probably just me not explaining it to you the way I should, because I did it in a very summary form. Basically, this is, if I can give you a little more detail on what I'm actually proposing. What I'm suggesting is that we create what I would call a health market all over the country. There'd be one here. You would go into that health market. You're required, I should have said this if I did, you're required by law to have health insurance. Everybody, health insurance, or I should say have health coverage. Doesn't have to be health insurance. But everybody has to have health coverage. Everybody, 100%. It'll take a little time to achieve that, but everybody has to have it. You go into this health market, and your choice is there are some private insurers that have bid and competed, with each other to get into the market, and then there's the government system. And you can choose whichever you want. You'll hear from your friends, your neighbors, etc. What's better, what provides better coverage. This is different than England and Canada. This is not, at least not at the beginning, a single-payer healthcare system. It's not just a government-run healthcare system. But what I was saying earlier is it could become that if the American people choose. If they decide over time that it makes more sense to them that they're getting better coverage for less money, more efficiently in the government plan. But that's something that will play itself out in the actual marketplace. In other words, we're not imposing it. You will decide. I mean, if you have private health insurance today, for example, and you would prefer to have private health insurance, then you can choose that. And then people who, obviously have a lot of seniors who are on Medicare, for example, if they think Medicare is better than private health insurance, then they can choose that. But we will see what works over time.
But then you'll have the poor getting the government program and the people who have better money, more money, choosing their programs.
No, no. And the reason that's not true is because of another piece that I probably glossed over too quickly, which is we subsidize health insurance premiums up to about $100,000 of income, which means if you are the poor, the lower income families, you're going to be 100% subsidized. So you can choose whichever you want. You can choose private insurance, and you're going to get money to pay for it. And so this thing is income related, is what I'm saying. We make sure that everybody has access. The whole idea is to get everybody into the system, everybody covered, and everybody with high quality care. And we don't want a system which I understand what your concern is. You don't want to have a system where poor people get one level of coverage and people with more money get a different level. And the whole idea here is to equalize the availability of care. Now, I don't want to mislead you. This is a proposal. It has to get through the Congress. I have to get the American people to agree with it. I believe I can do that. And it has gotten a fair amount of positive comment from people who do this kind of work around the country. But we have to figure out where the kinks are. If there are things that are not working the way they should work, we need to fix them. We need to be flexible. And this is a fairly significant change from the healthcare system that we have today. And I recognize that. And we're going to have to be flexible enough to understand if certain things aren't working, they need to be changed. The other thing that I should add that I didn't talk about earlier, we have a system set up for monitoring both the medication and the treatment for particular kinds of medical problems to determine whether there are some places in the country that a particular treatment or medication is being used and it's being very effective, and transporting that to other parts of the country so that we make sure that everybody in America is getting what in essence is the best treatment, the most effective treatment, or if it's medication, the most effective medication. So we have a system set up to try to make sure that the thing works as efficiently as it possibly can.
Senator,